Meditation, medications, your first psychiatric consultation. The golden rule is a universal truth, pages 1 through 7. Treat others the way you would have them treat you. Do no harm is the Hippocratic Oath. An ethical application of the golden rule. There are limitations to understanding the value of psychotropic medications. The nature of mental illness is not known, and this is stated in the package inserts for psychotropic medications. The package insert usually has a statement that the mechanism of action of the medication is not known. This is because the diagnosis of mental illness is based upon a collection of symptoms and not upon the underlying abnormality in brain function that, if corrected, would restore normal function. The FDA releases a medication for sale to patients based upon studies which document a reduction in symptoms greater than the reduction of symptoms caused by a placebo. There is no cure, but only a reduction of symptoms. The package insert usually gives a list of hundreds of side effects. It is not possible for the patient to understand and know all of the side effects after a single visit with a psychiatrist. I advise the patient to read the package insert before taking medications. I advise the patient to schedule as many appointments as necessary to review the package insert so that the patient may understand the risks and benefits of the medications. On the first visit, I advise the patient that psychotherapy, meditation, deep breathing, relaxation exercises, sleep hygiene, exercise, social activities, work, hobbies, and family activities all contribute to good physical and mental health. I advise the patient that there is no pill that causes happiness. I advise the patient that happiness is more of a choice than anything also, as people have been able to find happiness in the most difficult of circumstances. Finally, I advise patients that addicting medications for pain, anxiety, and sleep are only effective until tolerance removes the benefit and replaces the benefit with addiction. When addicted, the patient takes the medication to avoid withdrawal. During withdrawal, anxiety, insomnia, and pain are greater than when the medication was started. The curse of addiction. The most important thing to know about addicting medications is that they make pain, anxiety, insomnia worse at the end of treatment than they were at the beginning of treatment. That is the curse of addiction. That is why I do not prescribe addicting medications. Clozaril is the gold standard for treatment of psychosis. The literature often makes the statement that Clozaril is the gold standard, the best available medication for the treatment of psychotic mental illness known as schizophrenia. However, Cochrane reviews of medications have found that the published studies have numerous shortcomings, including small sample size, failure of double blinding, small and inconsistent differences among the antipsychotic medications. The studies are of short duration. The studies have flaws in methodology. One study found that clozapine was not superior to other antipsychotic medications. Clozaril is the most dangerous psychotropic on the market. It can only be prescribed after other antipsychotic medications have failed. It can only be prescribed if weekly CBC blood tests are performed to detect the loss of white blood cells, which are necessary to fight infection. Known side effects include agranulocytosis, which can be fatal, seizures, which can be fatal, myocarditis, which can be fatal, respiratory and cardiac arrest, which can be fatal, fatal eosinophilia, fatal bowel obstruction, and sudden death in demented patients. Thank you for your time and your kindness. Have a great day.